Good afternoon. It is such a pleasure to be with you this afternoon. My name is Csaba. I'm a board member at the European Cancer Organization in Brussels and Executive Secretary at the International Psycho-Oncology Society. Now I am speaking to you from Cluj-Napoca, Romania, from the Babos-Bolyai University, where I am Associate Professor and a researcher. During these dreadful times, I am member of the steering committee of the ECO and ASCO Special Network and the impact of the war in Ukraine on cancer. Thank you so very much, Luce, for your kind invitation. Thank you. Today, I am going to talk about the psychosocial perspective in cancer, especially in relation to lung cancer. So keep in mind, please, the keywords for this presentation: cancer, caregivership, and change. And these are my interests. War on cancer has been at the center of cancer policy and treatment in many parts of the world in recent decades. War on cancer actually takes us from the tumor-centered oncology to comprehensive oncology, and from patient to survivor. War on cancer is a highly personalized war that we have come to know better and better from person to person and from community to community. Over time, war on cancer has conquered important milestones in cancer prevention, early detection and diagnosis, innovative cancer treatment, and of course, very dear to us, in quality of life in oncology. So let me start by saying that the war on cancer is meaningful, but we still have to beat cancer. This is ongoing, as you can see. By 2040, the burden of disease from cancer in Europe is expected to increase by 21%, while the annual number of cancer deaths will increase by 31%. So the impact on the burden on formal and also informal caregivers will increase as the prevalence of cancer increases, and also as patient prognosis and life expectancies are improving. That means that more people with cancer and experiencing cancer are going to rely on psychosocial oncology services all around Europe. So it's very clear that most of us will be affected by cancer at some point in our lives as patients, survivors, or caregivers. And we must clearly state that all of these are inextricably linked. Actually, cancer caregiving is a significant cause of distress. We know that family caregivers are reporting high levels of discomfort and distress. That is highlighting the need to screen caregivers and identify individuals who might benefit from psychosocial interventions and support, according to a very latest report from Cochrane Review. Research shows actually that cancer survivors' physical and mental health has been associated with poor quality of life and increased caregiver distress. Let me take an example. In observing the psychological and also the physical situation of cancer patients and their informal caregivers over a year after diagnosis, it was found that patients and caregivers' report of the physical health were unrelated. But to the contrast, their reports of mental health at each time point between 1 year from the diagnosis were positively associated. So there was a small to moderate correlation between them. That means that when given a choice between a social support system intervention and a reduction in caregiver burden intervention, the latter may be better suited to reduce the intensity of psychosocial distress, both in caregivers and in patients as well. So, cancer, caregiving, and change. Yes, change. Because the psychosocial perspective means that we have to do everything that we can to change the psychosocial suffering wherever it is possible to modify it. So, how do we do that? How do we make the change and ease the unnecessary psychosocial suffering? Well, a good start, a must have in oncology, is cancer distress screening. The International Psycho-Oncology Society, which is representing psychosocial professionals from more than 110 countries, recognizes psychosocial cancer care as a universal human right. Actually, we believe that cancer distress should be measured as the sixth vital sign along with temperature, blood pressure, pulse, breathing, and pain. This is the IPOS standard of quality of care internationally on a global level. And when we're speaking about protocol, please have the quick links here for the English version of the instruments that we use for distress screening, which is usually the Edmonton Symptom Assessment system in Northern America and emotion thermometers in Europe, followed by the Patient Health Questionnaire PHQ-9 and GAT-7 for further screening depression and anxiety symptoms. So make sure you use them. And also, these are the basis for cancer distress-related interventions. Here, we have to make sure that these interventions are done together. They are carried out together. Patient, survivor, and caregiver, because the couple interventions will enhance the ability to cope together with psychological distress and also will support the couple's mental or physical health when experiencing cancer. So just let me give you some examples of this kind of cancer distress related interventions. Psychoeducational programs are the most widely used ones, but also cognitive behavioral interventions were found to be impactful. And let me say that we have to stretch and extend to also interventions that are having a boost, a protective effect on self-esteem. Because we know that, especially in lung cancer care, there is a stigma attached. And so, emotion regulation therapy and life review therapy have to be included with all the interventions that are strengthening the ability of patients, survivors, and caregivers to accept their circumstances and, more importantly, to find meaning in their circumstances, in their experience of cancer. And this is what we are talking about, especially in lung cancer, where, of course, psychosocial interventions, according to evidences, should aim towards survival. So, psychosocial and educational interventions should be provided to lung cancer patients and caregivers at all stages of the disease and the survivorship continuum in order to improve psychosocial well-being and quality of life. Because as we can see from the studies, quality of life is associated with survival in some cancer patient groups like lung cancer and gastric cancer. I highly recommend you to read the new article just came out days ago from the Journal of the National Comprehensive Cancer Network that I have shared with you here. So yes, we are having psychosocial interventions aimed towards survival. And also, this war situation is about survival. I just mentioned the ECO and ASCO special network and the impact of the war in Ukraine on cancer. So please make sure to help those in need. At oncohelp.org and at asco.org/Ukraine, you will find resources for patients with cancer, real-time information and contacts in several languages. Thank you for helping us, and thank you for helping patients in need. Thank you for your kind attention.